Think about this. As you age, suddenly you can't recall any memories, unable to complete daily activities, and you have difficulty speaking. This should mean something to you because these are the side effects of Alzheimer's disease, a disease that affects 1 in every 6 women and 1 in every 10 men over the age of 55. Actually, every 71 seconds in America, someone develops this disease, according to a journal by Griffith at the healthandage.org. Currently, my grandma suffers from Alzheimer's disease, and it's heartbreaking to know that every single time that I go and see her, she won't remember who I am. Alzheimer's disease is too common a phenomenon, and its outbreak will almost double by 2050. Today we will learn about Alzheimer's disease, its signs and symptoms, how caregivers of people with Alzheimer's disease are affected by it, and what the future outlook is for our Alzheimer's disease. Let's take a look at some of the signs and symptoms. Alzheimer's disease happens gradually and in stages. There is 7 basic stages. The first one starts with little to no impairment at all, and then gradually increases to like a just noticeable mild impairment, and then goes on to moderate and then to more severe cognitive decline. According to Alz.org, not everyone experiences the same symptoms or progresses through the stages at the same rate. Many symptoms that come along with AD, there are many symptoms that come along with AD. I actually have an audio to play. This is an audio by a learning center.
With Alzheimer's disease, the patient needs to be taken care of all the time. This is because the memory loss will often render the patient incapable of thinking and reasoning. Some will even forget how to do the simplest of tasks, like brushing their teeth and even eating with a spoon and fork. Alzheimer's is a progressive and degenerative disease that affects the brain. The problem often leads to massive memory loss, not only in terms of one's memory, but also one's learning. Patients will forget everything that they have learned, even routinary tasks that they have learned when they were just tots. Some people will also find it hard to learn new things and may even lose their language abilities. They will.
All right. Along with all those symptoms, there's just a few more, like confusion with time and place, decreased judgment, changes in mood and personality, neglecting hygiene, and sometimes repeating stories over and over again or words. Now that we know some of the signs and symptoms, let's look at the lives of the caregivers who take care of people with AD. Caring for someone with AD is really, really difficult, especially if it's a family member who is suffering. AD caregivers struggle with watching someone they care about slowly slip away day by day. From an interview I had conducted with my fellow co-worker Brittany Benson on March 25th, she said about her grandpa who suffers from AD that the person I've always known is different, so different that he is almost unrecognizable. The difference in dealing with someone it's different dealing with someone you have shared so many memories with, but they don't remember those memories back. Studies suggest that caregivers are more likely to suffer from depression and high levels of stress also. At first, when someone is diagnosed with AD, the caregivers usually go through a grieving process. And then they go through a stress process because they have to feed and bathe and support and take on all the household chores that they once didn't have to do. According to a 2006 report by the Family Caregiver Alliance, up to 70% of caregivers have at least some symptom of depression. And I have a chart. This chart is a chart showing the proportion of caregivers, people with Alzheimer's versus caregivers of other people. And the people who are caregivers of people with Alzheimer's are the purple lines, and the other ones are just people who are caring for others who don't have Alzheimer's, and those are the blue lines. And it shows how how much more stressful it is to care for someone with AD when it comes to like dressing or bathing or feeding. Now that we have touched on some of the stresses and everything that caregivers have to go through, let's discuss the future outlook of Alzheimer's disease. As baby boomers get closer to retirement, there will be tremendous loss of employees and a large need for caregiving. In the United States, the number of AD patients is set to triple to 16 million by 2050. We spend about $172 billion right now in the United States treating AD, and that is supposed to increase to $1.1 trillion by 2050. There doesn't seem to be an end in sight. 40% of people over the age of 80 are suffering dementia. It'll be 1 million new cases by 2050, according to a futurist named Jim Carroll. We have learned interesting info regarding AD and its impact on the world. As you can see, AD is very common and its impact will be greater by 2050. In this speech we went over the signs and symptoms of Alzheimer's disease, how caregivers of people with AD are affected, and the future outlook on it. Since we all have a strong chance of gaining or possibly getting Alzheimer's disease, be aware and live every moment day by day while you can still remember it. Thanks.